Um, what a great webinar. What a powerful set of discussions we've had today. I've been furiously writing notes of what was said, but also notes to myself, things that prompted my thinking going along. And so I'll just reflect on a few of those, not necessarily in the order in which they came up, but what's foremost in my mind. First of all, the duty to plan and to prepare. We've talked about, Cinda talked so eloquently just now about the moral injury. And she also mentioned the work that we did together with colleagues for 10 years, talking to Marylanders about crisis standards of care and allocation of scarce resources and who gets the one remaining ventilator. We need, and this was brought up by others, we really need to talk to the people, not get their reactions to what we've come up with, but try and understand as best we can from a wide spectrum of people from different backgrounds and different circumstances, how they think about this. And what we found in our work was people really engage in these conversations. They're not afraid to talk about this stuff. They're much less afraid of it than we are. And you can really engage in a conversation about this and learn a lot. So the duty to plan and prepare. This also relates to the issue of liability. We're focused on, as clinicians, we're focused on our personal risk of liability. The liability, I think, largely comes from institutions and not being prepared, not having done the work. As many of us who've been in this field for a long time know, we've been banging our heads against the wall for 20 years saying, we need to get prepared for a pandemic. We need to get prepared for a pandemic. We always hear, well, we have better use for our money. Well, so it turns out they really should have been preparing. And, I think that's where a lot of the liability comes from. So we talked about community engagement. We talked about, I thought really interesting to the comment about empathy building through training as an essential part of this. I think that's an interesting approach to it for me. The issue of load balancing, what a huge problem load balancing has been, and what a tragic problem. So many instances of a crisis could have been avoided by load balancing. We need to solve that problem. And the comment that was made that that the trigger for limited resources, trigger for crisis standards, is when the resources are limited. It's not when the declaration is made. So crises happen when there is a mismatch between demand and supply. It's not when the governor says something. So, and then I'll also get back to the Cinda's comment about we need to think about staff as a scarce resource, and we need to think seriously about allocating staff. And because as we've seen everywhere across the country, particularly in this last wave, our healthcare workers are just done. And so we need to think about how to use them in the best way. So with that, we come to the end of this webinar. We have one more webinar in this series. It will be on November 22nd, 2 weeks from today, at noon again. And this will be focused on looking forward. It's taking the lessons from all the previous webinars and talking about the kind of work that needs to be done going forward through the National Academies and elsewhere. So I hope you all will join us for that webinar, and thank you for your attention and participation today. And thank you to all the speakers and participants on the webinar. And with that, we will adjourn.